Good morning, good afternoon, everyone. Welcome to this Stats Café, ESCAP Stats Café on death registration, focusing on updated estimates, gender dynamics, and also some country perspectives. I'm really pleased to see you here today, and I'm also very pleased to have a very, very nice lineup of speakers for you. As you probably all know, death registration is a big issue in our region. We have many deaths that are not registered. Tum or Kunvirapon will talk a little bit about exactly how many. Back in 2014, all countries in Asia and the Pacific agreed to move towards universal registration of births and deaths and other vital events. But when we did the 2024 review of progress under the Asia-Pacific CRVS decade, we did find that there were still a lot of countries that are struggling to reach universal registration of births, but in particular, the universal registration of deaths. So this is what we'll be focusing on today, to look at what is the situation in the region and what are some of the efforts and experiences from India and Bangladesh. And we're very excited. We have both some quantitative elements and also some qualitative elements of the presentations today. So first off, we will start with Kunvirapon, who will present on the new regional estimates. We did some estimates of unregistered deaths back in 2023 based on 2018 data, but thanks to Kunvirapon, we are now able to have more updated data from 2023. So I'm very excited she's going to present on that. She has been working with us at ESCAP since 2023, but she is also a professor at the College of Population Study at Chulalongkorn University here in Thailand. We're very fortunate to have her in our team, and she's a very amazing demographer, and we're very happy with the work that she's done on this. So I will give the floor to you, Tum.
Tanya, for your kind introductions, and good morning, everyone. Like Tanya mentioned, today I will share the 2023 update on that registration completeness in our regions. Okay. Yep. So here's my presentation outline. First, I'll briefly explain why this matters and where the data comes from and how we produce the estimate. And then I'll walk you through the key results at regional, sub-regionals, and country levels. And we'll close with what this means as we move towards to 2030. So let me begin with why that registrations matter briefly. So that registration is not just a statistical exercise, it has real consequences. So it supports public health planning, it improves accuracy of population statistics, it protects legal rights such as inheritance, pensions, as well as insurance claim. It's also strengthening governance and accountability. So when that are not registered, people become invisible in this official system. So to understand how well this system are functioning, we assess completeness. So in 2018, regional completeness was about 74%, and that's meant roughly 1 in 4 that were not registered. In absolute terms, about 8 million deaths each year were not recorded. So that was our baseline for the first half of the CRVS decade in 2020, when we started in 2014. So the 2023 update will allow us to see what happened in the second half. So our goal of exercise is simple, just to see how much progress has been made and where gaps remain, especially as we move toward to the SDG target of at least 80% completeness by 2030. Our data comes from the update. Our data come from the 2025 CRVS Decade Review Questionnaire. So basically, we ask country to report data for 2019 to 2023. Out of 58 ESCAP member and associate members, 50 countries responded, accounting around 86%. So of this country, 48 provide that registration data. However, not all countries could provide both registered death and total death needed to calculate completeness directly. So we have only 34 countries that provide both pieces. So this is very important because data availability still vary across our region. So completeness is calculated very simply, registered death divided by expected total death. So unregistered deaths are the difference between the two. So where the 2023 data were available, we used them directly to calculate completeness. But where the data were missing, we apply standardized assumptions, mainly using the UN World Population Prospect estimate and then the most recent available national data. So for countries that did not submit the questionnaire, two approaches were applied depending on circumstances. So in some countries, we use data from external sources that are reliable, along with the UNWPP expected death. For other countries where no recent data were available, completeness was taken from 2018 ESCAP report, assumed to remain unchanged through 2023. So the key thing is that we try to apply the same methods consistently across country to ensure comparability. So our calculation process involved three broad steps. So input data at country level, calculations of completeness and unregistered death, and then we aggregate the result from country to subnational, to sub-regional and regional level. So now to the main results. In 2023, we estimate about 33.4 million deaths across the regions. Of this, around 30 million were registered, and that gives us a regional completeness of 88.8%. In 2018, as I mentioned, the completeness was at 75%. So this is an increase of 14.5 percentage point, which is almost 20% improvement. In absolute term, unregistered deaths have fallen from 8.3 million to 3.7 million. That is real progress, but still, 3.7 million unregistered deaths is still a large gap. Let's not evenly distribute. We have East and Northeast Asia has reached almost universal completeness. North and Central Asia is also very high. South and Southwest Asia has crossed the 80% mark. Southeast Asia stands at around 73.3%. We have Oceania showing 77%, but this hides major variations. Pacific Island country alone report around 20% completeness, while Australia and New Zealand are near universal. So across the region, we can see that completeness range widely from almost 100% to below 20%, and that tells us disparity remains a significant issue in our regions. So let's look at change over time. Progress has also been uneven. The largest gain occurred in East and Northeast Asia. South and Southwest Asia also improved strongly. Other sub-regions show more modest improvement. Oceania remain broadly stable. At the country level, the picture is quite mixed. We have 24 countries have now reached near universal completeness, above 99%. 17 countries are in the high range, between 80 to 99%. However, we have 8 countries remaining below 40%. Over time, we found that 34 countries improved over the 5-year period. Some recorded very substantial improvement, above 20%, above 20 percentage point. At the same time, we have 9 countries experiences decline of more than 10 percentage point. So the reason reported in the questionnaire include institutional restructuring, change in method of data collections, as well as COVID-19 related disruption. So we can see that the progress has been substantial, but it's not uniform. Before concluding, let me briefly note 3 methodological caveats. First, for some countries, the most recent available completeness rates was assumed to remain constant through 2023. That means where the system improved or the system has declined after the last reported year. Our estimate may not fully capture those changes. And secondly, where country did not provide us national estimate of total death, we rely on UN World Population Prospect. These projections provide a consistent and comparable baseline across country, but they may differ from national estimate and also come with certain assumptions. Third, in case where the completeness exceed 100%, we cap the value at 100% to avoid distortion at regional average. And this may conceal some issue like registrations or underestimate of mortalities. However, even though the assumption may introduce some of the uncertainty, they were necessary just to ensure the comparability across country. So let me end with 3 key messages from this exercise. First, the progress has been substantial. So the completeness increased from 74 to nearly 89%. Second, progress has been uneven. So we can see large disparity remain across and within subregions. Lastly, with 5 years to 2030, sustained effort is essential to prevent reversal and strengthening national mortality data system. So reaching SDG targets is achievable, but it requires continued political commitment. And at the end of the day, this is about making sure that every death is counted and no country is left behind. So to see the full report and country level estimate, please visit our website here. And thank you very much for your attention. Back to you, Tanya.
Thank you so much, Tum. That was a fantastic overview, and I think it really sets the scene for the rest of the Stats Cafe. Great to see so much progress, but I'm also very happy you highlight that some countries have even been going backwards, right? So there's definitely work to do. And some of that work we're going to hear about from our colleagues. First, we have Atiya Rahman, and she's an assistant scientist at BRAC James P. Grant School of Public Health at BRAC University in Bangladesh. She comes from a qualitative background, so she's an anthropologist and an expert in qualitative research. Her expertise includes focused ethnography, participatory and visual methods, systematic qualitative inquiry and implementation research across areas such as reproductive and sexual health, maternal and child health, nutrition, and civil registration and vital statistics. Also, she has worked in early childhood development and socio-emotional learning. So it's really nice to have someone with a qualitative background here. And we really look forward to hearing more about the work that has been done in Bangladesh. So this presentation is on barriers and facilitators to female death registration in Bangladesh. Over to you, Atiya.
Yeah, thank you very much, Tanza, for the nice introduction. As mentioned, I'm Atiya Rahman, and I'm working for the BRAC James P. Grant School of Public Health, BRAC University. And today I will be discussing barriers and facilitators to female death registration in Bangladesh. This study was a partnership between Gender Equity Unit of Johns Hopkins University, Humanitarian Hub at Bragg James Brigham School of Public Health, Bragg University, Vital Strategies, and the Registrar General of Birth and Death Registration, Government of Bangladesh. So let me start with a brief outline of the context of death registration in Bangladesh. Before 2004, Bangladesh civil registration system was largely ineffective. Although the reforms in 2004 and digitization in 2010 aimed to improve coverage, gaps persist. Only 17% of adult deaths are registered, just 5% for women compared to 26% for men. This disparity weakens gender-responsive health policy, maternal mortality tracking, and progress towards SDG 16.9 despite a legal mandate for registration. So we wanted to know aim to identify key barriers and facilitators to female death registration and explore practical ways to improve registration and promote a more equitable civil registration systems. For that, we did a cross-sectional exploratory qualitative study, and our approach was in-depth interviews, key informant interviews, and focus group discussions. The study was located in Rangpur division, located in the northwestern part of Bangladesh. According to the government record in 2023, Rangpur has the lowest female death registration rate in the country. Within this division, we selected two contrasting districts, which has the highest and lowest registration rate in Rangpur. So at the same time, we also within each district, we included both an urban and rural sub-districts to capture contextual and regional variation. And this is the sample size. In total, we conducted 76 units of interviews, including KII, FGDs, and IDIs across 2 districts. So this is actually our data collection process. For registered deaths, we began by visiting the local registration office to collect the list of registered deaths. For unregistered deaths, we relied on community-based identification through mapping and door-to-door visits to ensure accuracy and select participants. Social mapping was also helpful to identify registered households and verify the information with the official records. So these were the data collection process. And finally, data analysis has been done thematically, but we use the socio-ecological models to analyze this data. Let's move to our result sections. So what we found, let me start with the story of two brothers. That following the passing of their mother, after 15 days, the bank reached out requesting a death registration certificate. At this point, the elder son did nothing, but the younger son took responsibility and decided to begin the process. After 16 days, he went to the municipality office to apply for the death registration certificate. However, the office informed him that they could not issue a death registration certificate unless they had the deceased digital birth registration certificate. So what happened? They just applied for the digital birth registration certificate, and that they had to pay for 150 taka. And within 27 days, they finally collected the digital birth registration certificate. Then he proceeded to apply for the death registration certificate. This time online, that also required another 50 taka. After 34 days, he successfully then collected the death registration certificate. Now you can imagine how even a determined and proactive family member must navigate multiple steps, official requirements, and out-of-pocket costs. It also highlights how the lack of prior documentation can complicate and delay what should ideally be straightforward process. So we found from the community people that they have awareness on death registration certificate. They have awareness the death registration. They know the death registration is required for the registration for getting the property and other purposes. But what happened, people actually exactly don't know how the process and what exactly the reason, because they only knows that financial reasons is the most important. And let me talk about another quote from the registered participants. Here you can see that the registered participant, he said, "We did our mother's death announcement after the passed away. Municipal officials came. Since the municipality is very close to our house, they got notified quickly. Sometimes the ward commissioner also comes and notes down who has passed away, whether they were receiving an old age pension or widow benefits." This quote actually gives us a vivid example how communication can become a powerful facilitator for timely female death registration. In this case, the family promptly announced the death for their mother, for the mother, and then the officials came to them. The critical factor here was not only the announcement, but the proactive human response. The municipal officer assumed responsibility, guiding the family, collecting required information, and ensuring procedural compliance. So this is the another interesting findings from our present research, that we have seen that the social networks and local guidance play a significant role in facilitating death registration. Just see a quote. The man said that, "I have a friend in the municipality who works there. He helped me." Friends or relatives working in Union Parishad or the municipal office often make the process smoother and faster. Also, local leaders, including ward commissioners, provide direction and encourage families to complete the necessary actions. So you can see another picture where the village police, those who actually involved the collecting the information of the deceased person, and then advise them how to complete the death registration process. So this also helps the people to register their family members' death easily, if even the male or the female. So what happened with other cases, you can see that the most important part that I have already mentioned, that people only know the financial reason for doing the death registration. That is actually the main concern or main findings for our study. And we found that in various ways, for example, in many NGOs and rural financial institutions require a death certificate to close or waive loans issued in women's names. A male participant from an urban municipality here described how the death registration certificate not only enabled the cancellation of the loan, but also facilitated the release of the mother's savings. And families also explained that a death certificate was required to obtain a succession certificate and to legally claim land, savings, or other assets. That means getting property are also strong motivators for female death registration. This is another issues that we found from our study, that in many rural areas, even in our study areas too, women receive widow or old age allowances, and removal from the system requires a death certificate. Without registration, payments may continue unintentionally. So families are aware of this and often take initiative to ensure proper documentation, such as the registering the female death. So that was actually we found from how the system or the community people facilitate female death registration. But let's see another study While earlier examples showed how financial claims, inheritance, and allowances can motivate families to register deaths, there are some opposite reality. Here, after losing his wife, a man delayed the process due to grief and lack of awareness. When the insurance company later requested a death registration certificate, he faced repeated administrative hurdles, for example, unavailability of officials, online application barriers, missing some documents, and additional visits to the registered office, and that required time and the monetary issues. So after 8 months of frustrations, he gave up and said, if I ever need the death registration certificate in the future, I will do it then. You can see the word if I ever need. So what the mean to need to them actually. So they said that if there is no financial benefit, then there is no indication to register the death. So what does it mean? Taking this further, we can discuss that what we are really seeing is a structural pattern. So, if registration is driven by property, inheritance, or financial claims, then women who are less likely to own property in their own names are automatically disadvantaged. As the national level informant here, you can see, he mentioned that when a woman does not inherit or hold assets, families often see little practical reason to register her death. So the issue moves beyond the motivation, that personal motivation or administrative barriers. It reflects deeper gender inequalities in ownership and power. So I have already mentioned that people have some awareness about the death registration that they need for the property. They need the death registration certificate, but already I mentioned that they know how to get this death registration certificate from the institution. So you can see a poster that is actually hanged on the Union Parishad office or municipality office. But you can see that although these posters are displayed in local registration office, highlighting 18 reasons for birth registration and 4 for death registration, the information exists, but it does not effectively reach or engage communities. What does mean? I mean, as a result, that happens, the awareness remains passive rather than proactive. So we also found from the community perspective that what happened with the complex system. So system also matter. As the respondent here described, even when someone attempts to register a death, repeated visits, unavailable staff, delays, and requests to return another day can discourage them. Over time, frustration builds, especially when distance, transportation costs, and household responsibilities make each visit burdensome. That I have already mentioned from the previous examples. So in summary, what we found all the factors that are here that interlinked with each other, and these factors of some factors which is the similar that the hinders death registration from the family members. So from our research findings, what we recommend from the overall death registration process, we recommend for the overall death registration, we recommended reducing the paperwork to make the process less burdensome, strengthening human resources to address service delays, integrating registration within public systems to create routine linkages, expanding services that require a death certificate to create practical incentives, and running awareness campaigns to reinforce its legal and civic importance. And especially for the female death registration, we have some recommendation. Specifically, targeted strategies are essential because women face structural disadvantages. Gender-sensitive messaging and staff training help address bias and improve service experience. Addressing social norms and increasing female registers can reduce mobility and comfort barriers. Ensuring equal access strengthens women legal visibility, and disaggregating data by gender allows ongoing monitoring of disparities. So these are all from Bangladesh research part. So we acknowledge all of our partners here. And thank you very much.
No, thank you. That was very, very insightful. And I have a question for you later, and maybe also for Chandan, regarding the female registers, and if you have an idea of kind of the proportion of registers that are currently female, that would be quite interesting. It's an area I've never really learned much about. But thank you so much. I mean, I think what your presentation really highlight is the contextual elements of what registration means in local communities and how the human connections are important in the registration process and so on. You also very much highlight the role of incentives, which I think we generally struggle with for death registration in many countries, that there are generally fewer incentives for death registration than for birth registration, but I think really highlighting that in your research is really important. I think it was also very interesting to see some of the practical issues, right? And also I really appreciate that you highlighted the impact on real people and took out some of the real stories. I mean, that's one of the beauties of qualitative work, and that was really, really nicely put. So thank you so much, and I'm sure there'll be some questions later. For anyone who has questions, please feel free to put them in the chat, and we should have a bit of time at the end to go through them. But before that, we have our last presenter of today, and I'm really happy that we have Chandan Kumar here. He is a doctoral fellow at the Department of Biostatistics and Epidemiology at the International Institute for Population Sciences in India. He also was a participant in our CRVS applied research training, which is kind of our research arm of some of our activities. He is currently working on his doctoral thesis, which is on civil registration systems in India, methodological gaps in loss functions, and the revision of mortality estimates. And his presentation today is also on the completeness of death registration in India. So I'm very happy to give the floor to you, Chandan. Thank you.
Thank you, Tanya, for introduction. As you know, my name is Chandan Kumar. I am a doctoral fellow at IFS, India. I am focused on completeness of death registration in India. India's civil registration system established under the 1969 Act mandate registration of birth and death. Over the past decade, death registration has increased substantially from about 66% in 2009 to nearly 96% in 2023. Death registration keeps the foundation for producing reliable demographic indicator, including age-specific mortality rate and life expectancy. Without accurate and complete death registration, national mortality estimate may be biased. These directly affect health population, health planning, and policy decisions. Beyond its statistically important, death registration also identify the determinants of under-registration, particularly among vulnerable groups. For instance, lower participation of women in the formal sector may reduce institutional channels through which deaths are officially reported, contributing to gender disparity. However, accurate and timely death registration is essential for monitoring progress toward the sustainable development goals and for strengthening civil registration and vital statistics systems. There are two objectives. First, to examine the completeness of death registration by sex, and secondly, to examine the socioeconomics and demographic differential in death registration by sex. I am using 4 data sources: CRS report 2009 to 23, SRS report 2009 to 23, RGI projected population 2011 to 36, National Family Health Survey, that is called India Demographic and Health Survey. In the upcoming slide, we will give detailed description on these 4 data sources. For completeness of death registration was calculated a number of deaths registered during the years and divided by number of estimated deaths for a year. Number of estimated deaths for a year calculated is as mid-year population and death rate. In any passage, they give household unit level survey, and we have calculated death registration, which have registered with civil authority, that is called 1, and which have not death registered with civil authority, that is called 0, and there are also independent variables that is called age group, sex, education, wealth, contact, religion, caste, place of residence, health insurance, bank account, and region. I have keep all these independent variable in NFHS. That is input data. The CRS provide administrative records of registered death, forming the basis of assessing reporting coverage. And the SRS survey independent demographic surveillance systems, offering reliable estimate of CDR and age-specific mortality rate. And population projection from the RGI provide denominator necessary for estimating completeness. And finally, the National Family Health Survey offer household level information on whether death occurring in the previous 3 years were registered with civil authority or not. By integrating administrative data, demographic estimates, and survey evidence, this study triangulate multiple sources to assess both the level and equity of death registration completeness. And results. This slide presents trend in the completeness of death registration in India using 3 data sources: CRS, ESCAP estimates, which have released in 2023, and NFHS 5 that was conducted in 2019-21. The CRS data show steady and substantial increase in reported completeness, rising from approximately 66% in 2009 to nearly 96% in 2023. The most rapid improvement occurred after 2027, with reported estimate reaching 100% in 2020 and remaining above 90% thereafter. The ESCAP to 2023 estimates of around 94% closely aligned with recent CRS level, suggesting a strong overall administrative coverage. However, the NFHS 5 estimate is lower than CRS in 2020 at about 71%. In this graph, the CRS data showed that completeness has improved steadily for both sexes over time. However, male deaths are consistently reported at higher level than female deaths throughout the period. In several recent years, estimated completeness for men has exceeded 100%, while women completion remains slower through also substantially improved. However, their gap, that is gender disparity, is narrow over time. I have some logical reasons why male death registration is higher than 100%. First, this data have not given by sex, so I have assumed that this was a person. First, the distribution remained relatively stable over time, with approximately 60% of registered death attributed to the men and around 40% to women. Importantly, the NFHS 2019-21 estimates show a very similar proportion distribution between men and women compared to CRS data. So this data I have not given by sex, so around 10% delay registration are registered every year, when deaths that occurred in previous years are registered late. They are counted in the current year's total, inflating the number of registered deaths relative to the expected death. As a result, annual completion estimates may appear artificially high. These are the sub-national estimate. This figure highlights substantial progress over time across most states, with many states approaching or reaching near universal completeness by 2020 and 2023, particularly in the southern and western regions. However, notable regional disparity remains. States in the northeast and parts of the east and central regions show lower completeness levels, especially in earlier years, that is 2009. Although improvement are visible over time from 2009 to 2023, consistent with the earlier national finding, male completeness tend to be higher than female completeness in many states, so the gap has narrowed in recent years. This was estimated by NFHS. NFHS 5 data also shows that some states such as Goa, Kerala, and several southern states reported a high level of completeness for both sexes. In contrast, states such as Bihar and certain northeastern states show considerable lower levels, particularly among women. The consistency between CRS-based and NFHS-based state patterns suggests that disparity are not limited to administrative reporting differences, but reflect genuine state-level inequality in death registration coverage. In this graph, urban area reports substantially higher registration level compared to rural area for both men and women. For example, urban male completeness ranges from approximately 80 to 89%, whereas rural male completeness remains lower, around 67 to 73%. A similar pattern is observed among women, with urban completeness around 77 to 83% and rural area considerably lower, ranging between 58 and 63%. This finding indicates place of residence remains a significant determinants of death registrations, and the rural women are among the most under-registered groups. Similar to the earlier findings, some states of Goa, Kerala, Tamil Nadu, and several western and southern states consistently report high completeness level for both men and women, often approaching or exceeding 80 to 90%. In contrast, such as Bihar, Jharkhand, Uttar Pradesh, and some northeastern states of comparatively lower level, particularly among women. Men and women, with particularly high level observed among middle-aged and the older adults, especially age 35 and above. In contrast, lower completeness is observed among young children and adolescents, especially in rural areas. Socioeconomic and demographic variables are strongly associated with death registration, as completeness rises steadily with higher educational attainment and wealth quantile. For example, individuals in the richest household and those with higher education exhibit a substantially higher registration level than those in the poorest or least educated groups. Similarly, households with insurance coverage or bank accounts so higher completeness suggested that financial inclusion or institutional engagement are associated with improved registration. Differences are also visible across caste, religion, and region, with western and southern completeness suggested that financial inclusion or institutional engagement are associated with improved registration. Differences are also visible across caste, religion, and region, with western and southern region is generally showing higher completion compared to eastern and central areas. Overall, this slide demonstrates the death registration not uniform across the population, rather it is strongly shaped by socioeconomic status, institutional access, and geographic location, with women, rural residents, and disadvantaged group experience lower completeness. Logistic regression showed that richest household is 2.66 and 2.67 times more than poorer household among men and women respectively, similar to the higher educational household, which is 1.33 and 1.87 times more than no educations. Death registration is not uniformly distributed across the population. Completeness is lower among infants and young adults compared to middle-aged and older age groups, and women consistently experience lower registration level than men. A strong socioeconomic gradients are evident, with higher wealth and educational attainment significantly associated with a greater likelihood of registration. This pattern indicates that despite national level improvement, disparity persistent across age, gender, and socioeconomic status. Therefore, policy efforts should move beyond increasing aggregate coverage and focus on improving equity and data equality. A strengthening digital and mobile-based CRVS system can enhance timelines and accessibility, particularly in underserved areas. At the same time, targeted intervention are needed to address the structural disadvantage faced by rural populations, women, and socio-economically marginalized groups, ensuring that death registration systems are inclusive, accurate, and responsive to all segments of the population. Thank you.
Thank you so much. That was a very rich presentation with a lot of very interesting data points. I think a few takeaways from my perspective is definitely the challenges with the different data sources and the potential differences with the results from those. And there was one particular graph that I noted, which was the one where you showed the gender. I mean, generally it is as expected, but sad to see the very big discrepancies between female and male death registration, with women being much less likely to register. But in the graph you had on the different regions, where it showed the level of registration, there was one state of India where the registration rate was higher for women than men. So it'd be very interesting to look into that. But thank you so much, and I think it's a very nice compliment to the qualitative work from Bangladesh. There's some really strong gender elements in both of these presentations, and also the improvements over time is very obvious, very linked to Toom's presentation as well. We had received a few questions in advance that I would just like to mention. And of course, if anyone who is participating today has questions, please feel free to put them in the chat box or raise your hand. And we have about 15 minutes, so we should be able to cover a little bit of ground. So just going back to my previous question, it would be interesting if either Chandan or Achia or maybe Toom from Thailand knows something about the gender distribution of registers themselves. That would be quite interesting, just because I know nothing about that topic, so it would be very interesting. And then one of the questions we had received in advance was about the role of digital registration systems and digitalization in general. So how you think the increased digitalization and use of mobile technologies can improve timely and complete registration. So if you have any thoughts on that, it would be great to hear. And I just have one more question, which is about persons with disabilities. And this is generally an issue we know quite little about. So if any of you have any insights, that would be very interesting. If you have any insights on completeness of death registration amongst persons with disabilities. And the particular question we did receive was on persons with intellectual disabilities, but I think in general we know very little. ESCAP has done some work supporting a few countries on assessing inequalities in civil registration. And the only country where we were able to look at registration completeness for persons with disabilities was in Indonesia. And there was some discrepancies there with lower levels of registrations for persons with disabilities. But this was for birth registration, not for death registration. So it would be very interesting if you have any insights on this aspect for death registration. And I think this relates generally to the kind of relationship between socioeconomic characteristics and death registration. And I think both of you touched a little bit on it. But if you have any more insights, that would be great. And I'm also seeing the chat box going off with a few other questions. But maybe if we start with these ones, who would like to go first? Achia, do you have any great insights to share?
Thank you, Danza. Regarding you have mentioned about the digital registration systems or mobile technologies. So in case of Bangladesh, that in Bangladesh is already working to improve its digital death registration system as part of a broader effort of strengthening civil registration and vital statistics. So under the Birth and Death Registration Act 2004 that I mentioned earlier, death must be registered within 45 days. So the government now uses the online birth and death registration system that we shortly mentioned, the BDRIS, which allows the local offices to issue digital certificates and store data centrally. However, death registration remains much lower than birth registration because families often see less immediate benefit in registering a death that you have already seen from my presentation. To address this, we have from our school, we did another study, and the government have a model that mentioned about the Kaliganj model that launched in 2016 in Kaliganj Upazila, Gazipur. Is very near to Dhaka districts. Introduce a more active approach. Instead of waiting for families to report deaths, health workers identify deaths during regular household visits and notify registrars directly. When no medical certificate is available, trained health workers conduct verbal autopsies to determine the likely cause of death. The model also improves coordination between health officials and local government registers. The pilot significantly increased timely death registration and has since been expanded to other parts of the country. So the long-term goal is the universal death registration by 2030, ensuring every death is recorded and properly certified to support public health planning. So already the digital death registration system is ongoing in our country for the birth and death registration issues. Thank you.
Thank you so much. That's very, very insightful. Chandan, do you want to respond to my many questions as well?
And I am responding in India. Actually, government have already told that they will provide mobile-based registration system in some years ago, in 2023 or 22. But now India is expanding online CRS platform in many states which allow real-time data entry and centralized monitoring. But currently there are no mobile-based registration systems. Yes, of course, mobile-based registration systems, particularly through frontline workers such as Anwari worker and local research, which will improve reporting in rural area and remote area where access to registration office remains limited and they have not mobiles also. And digital system also enable automated validation check, which are doing in India, reducing clear errors and inconsistency in A6 and date reporting. Actually, death registration in India was reported at the panchayat levels, and panchayat administrative is responsible for validation for deaths in India, which are recorded in computers. Okay, thank you, Dicha. I have only this.
Thank you so much.
You have asking for the disability, intellectual disability, but in CRS in India, there are not any intellectual disability reported in CRS and NFHA data. So
yeah, we would definitely need other data sources as well in order to be able to look at that. I was wondering too if you have any things you want to add.
Maybe something related to mobile registration. So this is one of the reasons that mentions in the questionnaire for the country with the decline in death registrations over time. So they mentions about inconsistent implementations of mobile registrations. So like the projects is short term rather than long term. So that's part of the reasons why we see regressions in that registrations over time. Thank you.
Thank you so much, Tum. And we also have a question in the chat box regarding the Philippines. Just if you're not seeing it, it says for the Philippines, for countries like the Philippines, where around 10% of deaths remain unregistered, what typically explains the last mile gap, and what safeguards should countries like the Philippines put in place to avoid backsliding? And just my own few cents on this, both, and it actually links very well with Ajia's presentation as well. I think that we need to limit the barriers to registration, right? We need to make it very, very easy. I mean, as Ajia mentioned, in several cases, people would have to go back and forth to the offices, and there's a lot of waiting time, and you know, maybe there's some direct costs, but there's also a lot of indirect costs for transport and time. So in my perspective, what we need to do across the region and probably beyond the region as well is making sure the registration is very, very easy, right? So limiting the documents needed, limiting ideally any physical interaction if possible, doing it more automated, and of course, the digitalization is one tool towards that, but it's not the only tool needed, right? You can't just digitalize the existing processes and assume that they will then be easy for the families. One of the areas of work that we are supporting from ESCAP side is business process mapping, where we basically go and help individual countries, or in India, we are supporting a few states to really look in detail at the processes and how they can be simplified and improved to make it easier for families. And I think that's underlying the thing that needs to happen. I also very much agree with Tum that mobile registration campaigns and so on can be helpful, but if they are not structurally implemented and if it's not an ongoing effort, then it's not going to be an ongoing impact, right? So I very much agree with that. I think, Achia, you had something else to add?
Yeah, I just wanted to add regarding the disability issues. So, from our study, we didn't find any information from that particular population from the registration office. But from in our country, actually, the disabled child and disabled as well as disabled people actually get social an ID card, that the disabled card, disability card, that is actually provided by the Social Welfare Ministry of Bangladesh. And what we found during the registration process, if there is in the death registration process, and if it is in the birth registration process, this ID card should be submitted, and that is mandatory. So but in the registration certificate, there is no implication. We didn't find any mention information there in the registration certificate. But I'm sure that there is some data that the how many disabled persons have deceased in that particular area. But I am confirmed that there is very limited information, even among them in death registration for people with intellectual disability. Though I don't have enough information right now. But if we want, then I think there is some data from the registration office.
Thank you so much. Yeah, there's a lot to look into here, and I think one of our questions actually also highlights that. So there's a question from Bangladesh saying, since there are multi-level barriers and facilitators of death registration, how can existing law and health system be integrated to play a role in increasing the rates? And also, the data discussed today available publicly for further research and advocacy purposes. So I think this is Toom's paper on death registration completeness was already shared in the chat, but I think Chandan and Atya, if you have any research that you would like to highlight in the chat, please do so. I think it would be very welcome. But I think we are almost at the end of today. Just highlighting that we do have a CRVS research forum coming up at the end of March. And of course, there is quite a lot of work in there on death registration as well as other areas of civil registration and vital statistics. And we are welcoming people to register at that event, either for in-person or online participation. So if you want to learn more about this issue, that is a good option. So thank you so much. I think this was really insightful, and I really enjoyed the kind of qual quant setup. I think it's really nice to have those two different aspects. It's a very, very different perspectives, which is fantastic. So this Stats Café is a part of a series of Stats Cafés that we are running from the ESCAP Statistics Division, and they cover a large area, many different topics. The next one will be on the 9th of March, and it is about coding classification with AI. So very different topics, but hopefully you will be joining that and finding that interesting as well. Also, just to highlight that we do keep the recording and the presentations from the different Stats Cafés on our website. So if you would like to revisit this one or any of the other many Stats Cafés that we've held so far, you can always go to our website and find the old Stats Cafés, as well as keeping an eye on upcoming Stats Cafés. So this one is the next one on clothing classification. And finally, we have now established a LinkedIn group for official statistics in Asia and the Pacific, and it's open to anyone interested to join. It's a nice way to keep track of what is happening and also potentially share your own work. And also, of course, we also advertise the Stats Cafés and other things on that group as well. So if you have a profile on LinkedIn, please feel free to sign up using the QR code, and my colleagues have also very kindly put it in the chat. So I think that is it for me. Well, lastly, of course, there wouldn't be a CRVS Stats Café without mentioning the CRVS newsletter. So if you haven't already, please sign up to our CRVS Insight newsletter. It comes out once a month, and it's a very easy way to keep track of what is happening across the region and beyond on anything CRVS related, really. So thank you so much for joining today. I hope you found it as insightful as I did. I really enjoyed this, and a huge thanks and applause to our excellent speakers. And have a wonderful day ahead, everyone. Thank you so much.
Thank you, everyone, and thank you, Tanja, for inviting me.
Thank you so much.
Thank you so much, everyone.